we will be sharing with you the third webinar of our series, Saving Lives with Autotransfusion, Lessons from the Field, a Sisu Global webinar series. My name is Dr. Juan Carlos Puyana. I am a acute care trauma surgeon at the University of Pittsburgh. I am also in charge of the Office of Global Health in the Department of Surgery. And because of that, I have the opportunity to work in many areas internationally related to global health and global surgery.
Where we process blood for transfusion is 300 kilometers away. The nearest blood bank is in Eldoret, 300 kilometers away. This particular time, we had no blood.
For the surgeons in the group in the webinar, it will be critical that even within the limited resources that you may have at your hand, whatever is it that you work, the moment that you can rule out any contamination, then you should be able to proceed and introduce the system to obtain autotransfusion.
But then a colleague of mine who had been trained on the Hemafuse, on the use of Hemafuse device, actually at the theater nurse, alerted me that we have an Hemafuse device which we can use to harvest some of the blood and then we auto-transfuse. As an emergency, we took the lady to theater, opened the abdomen, did X-lap operation, and then my colleague used the Hemafuse device to salvage the blood in the abdomen.
One, the use of Hemafuse, our experience with the use of Hemafuse was quite resonating well, because it's not a very technical and hard device that requires one to be a bit intensive and to be able to use. So just pre-op a few minutes before the surgery, because it was in the evening, we had no blood. We also had few of our colleagues in theater by then, only 3 of us.
We are grateful for the Hemafuse device and technology, which allowed us to harvest that blood, transfused it to the patient with an HB of 5.4. Successfully, we did a successful operation.
Looked at the demand of having blood in the stores. At least the demands went a bit down when we were able to harvest the patient's own blood and give it back to them when they were in need of it. And then the hospitals, in terms of costs, were able to have less number of volunteers who are being recruited, conducting these tests, typing the blood, cross-matching it, even transporting and storage it. So all these costs at some point were minimized when we were able to use the autotransfusion.
So, yes, the parts that can be reused up to 25 times. And I'll just show with my video. So you have the hard plastics as the components that can be reused. So this is the plunger, all right? So this can be reused. You have the collecting barrel, all right? And you have the nozzle, and then you have the O-ring. Okay, so just to help people remember, I usually say the very hard plastics and the rubber. So everything that was connected to the collecting barrel, that is the input and output accessories, those are discarded and are not reusable.
I hope that everybody enjoyed the presentation. I want to thank both the speakers who share their experience with these difficult cases and their experience with the use of the autotransfusion system. Thank you, Dr. Hassan. Thank you, Emma, for these very informative video information. And also, I want to thank Mayor Dr. Ikuro Kidalio for their contributions. I want to thank all the people that came to the seminar, and we hope to see you soon. Not being anything else, I think we say goodbye to everyone. Had a good evening in Kenya and anywhere else where you are, and a good rest of the afternoon here on this side of the world.